Stop worrying about all these things because whenever you're at the top of the pile, that also puts you at the bottom of another pile. Hello guys, welcome back to the channel. I'm Kyakasha Mamtaz. You already know me. In this channel, we talk about the IMT journey, the journey of doctors from overseas, their journey about coming to the UK, making it to the training program, the difficulties, the easy bits. And today we've got Dr. Yasin Arac with us.
Hi everyone.
Thank you so much for coming to the channel.
Always.
Yasin has just joined the medicine training program, and today he'll be sharing a couple of
My
things about that.
experiences, and we'll be talking about how to get into IMT and maybe how to complete the IMT one and carry on the further steps.
Yeah. Yasin has started his journey as a medicine doctor or a medico from Turkey.
Yeah.
So he's been on the same IMG journey like us. So hopefully you guys will relate to him. So without further ado, let's get started. All right, Yasin. So this is how much I know about you, but there must have been pieces that I missed from your journey. So tell us a little about you.
Okay, so I will start from today. I just recently started my IMT training, and today's video is going to be more like how to get into IMT and how to get through in IMT. We were talking about it, but I graduated in 2021 and worked in Turkey for 2 years in A&E. And in 2023, I moved to UK, and recently I got into IMT. And I also have a Instagram account, Beyond the Doctor UK. You can follow it if you want to see more about my life, but most of my content is in Turkish. So yeah, it's me. It's how I get into that journey. And now I am just in the beginning of the IMT, but I'll be talking about how to get into IMT rather than how to get through the IMT. Yeah.
The difficult and the easy bits. So starting with the most important question, which is how to prepare the right CV for these training programs.
So I think it really helped me to have a non-training job in the UK to build up a CV. But before coming to the UK, I had a bit of experience in Turkey as well, so it helped me to build up my CV. So there are a couple of things that you need to think about beforehand before applying to IMT, such as publications, such as audit, quality improvement projects, such as teaching experiences, or you might need to have a leadership I mean, it's not mandatory in IMT training right now, but it might change, and you might need to show them that you have a bit of leadership experiences as well. These are the main things that you have to do, and if you can do postgraduate qualifications. So, in my experience, I didn't have any postgraduate qualification. So you can have master degree, you can have PhD. These are going to give you good points actually, and it's a bit important to have if you have. But I know it's very difficult to have a PhD just after the graduation, so it's not very doable. But if you have, that's good point.
So you've mentioned all these things that we can do to build a good CV and all these points that we need to cover. But as per your experience, what do you think has been the most difficult area to get points on? And because most of us, we start thinking about the training program sometime around March, April, and then comes November when we are actually applying for it. So in those 5 months' time, if someone has to maximize the points for CV, what do you think would be the best way to do that?
I think the difficult part is the research. It takes long time. It gives you good points. It gives you good scores, but it takes time. The easiest thing to do to increase your scores, I think, getting the audit and quality improvement projects done. Get a good teaching setting done in 3 months. Like if you have a 2 weekly or weekly teaching sessions in 3 months, then you will get a full score from that. It might be, it is doable. I think you can do it. And audit is also simple audit also can be done quickly in a couple of months. It also brings you a good point to cycle of audit. I think those things are easy to do when it comes to the IMT portfolio rather than working on research and trying to complete in a couple of months. You can easily get a case report done, which might bring you a point, which might bring you a score. And also you can get some poster or oral presentation as well, which I haven't mentioned before, but it also the part of the IMT portfolio. If you got a case report, then you can present it. You can have a poster presentation of it. It will give you a score as well. So these things might be doable in a couple of months.
That's nice. Thank you.
Question.
So tell us a little bit about, like, okay, you applied for the training program. After that, when I applied for training program, it was that you get selected for the interview, you get shortlisted for the interview.
Yeah.
And then
we got shortlisted with our self-assessment scoring. So all these things that you have done, research, audit, quality improvement projects, teaching, oral or poster presentation, leadership experiences, all these things are giving you scores, and then you self-assess yourself. Of course, they are asking sometimes evidence of it. So whether you have some evidences, they might or they might not ask, and you get your self-score. So there is a cutoff point. It was last year, it was I think the year before my year, it was 13 or 12, and then it's gone up to 16 if I'm not wrong. And so if you get more than this cutoff point, and then you get a chance to be in interview. So last year when I applied, my score was 25 out of 30, so I easily got an interview. And when it comes to interview, you gotta learn how is the interview itself, because interviews are not the thing that I used to do back in my country. So I had to learn from the beginning.
That brings us to our next question, which is, how did you prepare for the interview? And what is the structure of the interview?
The structure of interview is, in the first 2 minutes, you talk about yourself. You got to prepare your talk very good, because you only have 2 minutes to talk about everything that you have done, and you need to give them the bullet points so they can catch up the things that you have really done important. And then after that 2 minutes, you have the different sections like ethical scenarios. You have medical patient scenario that you have to talk, and they also ask some questions about your CV and your 2 minutes of presentation. So you gotta be prepared for all these questions, all the possible questions that might ask about your CV. For example, in my case, if you have a presentation, it might be important to know the details of your presentation, of course, and they might ask you more questions about it. So it's all related with your CV, and also with some medical information like management of a medical case, like diabetic ketoacidosis you have to manage maybe, or there are some cases that you have to know to get into that training and also to pass the interview. And also there are some ethical scenarios as well. How did I study is, actually we use some question banks. There are some IMT question banks. I'm not sure should we give the name, but you can leave a link if you want.
What are those things? I'll let it if need be.
So there are some websites, and then there are some sources that you work on it, and then you can get some mock stations with other IMTs, or you can ask your registrars, you can ask your IMT2s to have a mock stations with you, and then you learn from them. The best way is practice, because you've got to tell yourself in 2 minutes. You have to have a precise and clear 2 minutes of presentation, and then you have to practice all possible medical cases that might come in your interview, and you can use these question banks for it. That's how I prepared. It took like a month, I would say. I started a month or 1.5 months before, and then in the last 20 minutes I spent like 2-3 hours every day, because it was a bit difficult to get all these ethical scenarios and all these medical scenarios as well.
So would you say it was the ethical scenarios that you thought was the most difficult one?
Oh, the most difficult one? Can't remember really. I can't even remember what I got in my interview. I just deleted them all after passing.
Right.
Not passing, I mean after the end of the interview.
Right. I think a couple of things that some people might ask you about is, so there's this special topic during the interview, which is called the suitability for IMT, which is basically your introduction followed by why do you think that you're suitable for IMT. So most of the people in those 2 minutes, they try to cover everything, and that's when things get difficult, because you're trying to cover everything, but you want them to ask you very specific questions. For example, like Yasin mentioned that he presented something, there was a publication that the interviewers talked to you about and wanted to know more about. So it is very important that you mention those things first, or highlight those things. So take good time to mention those things that you think will benefit you the most during the interview. It's not only about portfolio scoring anymore. It's more about what is interesting and what do you think interviewers might find interesting.
And also, I would say, I would like to say one thing. What these things that you have done is beneficial for IMT. Why is it beneficial for IMT? They might expect you to be aware of these things, and they might start asking you questions about it. Because in my interview, they asked me one question. The question was, why do you want IMT? And I told them that this is blah 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 blah, and I waited because I expected them to ask another question. They didn't. They're like, oh, that was your question, do you want to add something else? And I kept talking. So like I spent like weeks to prepare all these questions, all these possible questions that they might ask, but they only ask one question, why do you want IMT? So it might happen as well. Better to be prepared, everything. And the main thing is why IMT, because they really want to know that. For example, the answer is not, oh, I want dermatology, that's why IMT. No, because it's a bit different. You shouldn't be saying that. You should be like, well, IMT will give me that knowledge that will prepare me to become a better physician. Those kind of answers will be more helpful, I think.
I think for me, they asked me about what particular department or what particular specialty you want to join after doing IMT. And at that time, I didn't really have anything in mind. So I gave a vague answer, but I mean, it varies from deanery to deanery, interviewers to interviewers. They might ask you a very specific question that why do you particularly want medicine, or what do you want to do in the future, or something or the other. It's just that you need to prepare those questions really well. And when it comes to preparation, I don't know if Yasin gave it away, but it's MediBuddy, the app that I use most.
I use MediBuddy as well, and
so it gives you
interviews
and
optimize interviews. Okay.
So in those, there are multiple questions. There are sections where you can get the same question in different formats. So when it comes to introduction, they might ask you the same question in different areas, and that might confuse you. So it's good to prepare like well in advance. And as you know, nowadays everybody is getting good points when it comes to portfolio scoring, self-assessment, because everybody knows about audits, everybody knows about research. But the make or break is the interviews these days.
Yes.
At least during the last time when Yasin participated in the interviews, that's when interview really decided who got the position.
Yeah, it doesn't matter how much self-assessment score you have. After you got into interview, like 1,500 people got interviewed, I think, if I'm not wrong. And all these people ranked only by interview scores, not by other thing. So the real thing is.
So wasn't it like a cumulative score?
No, it wasn't a cumulative score. It was only purely your interview score that you are ranked by. So.
Because during our time, which was 2 years ago, they did a cumulative score. Yes, they included the portfolio score.
So that might
plus
change.
That, and then they added the weightage.
That might change. Last year it was purely interview score, so it was really important to be good at interview. So it might change. Better to keep checking the training website.
Right. Okay. And how much difference do you think the deaneries or selecting the deaneries would make? Because many people are confused about it. Many candidates are like, should I go for London Deanery? Should I go for West Midlands or this or that? Have you noticed anything, and what did you choose?
It's my personal idea, but what I thought about it at that time was, so I didn't choose Oxford, Cambridge, or London Deaneries, because I kind of feel like interviewers are going to be the consultants, going to be the tutors, like probably the professors might be the interviewer at the same time. So they might have, if from these cities, like from these big cities like Cambridge, Oxford, and London, they might have a higher expectations from that level, because they always work with a competitive students, they always work with a competitive trainees, so their expectations might be higher. That was the thing what I thought. But it's also good to be in these cities as well, to have a easy accent of the interviewer at the same time. That might be helpful. So I picked West Midlands because I am in West Midlands, and I didn't want to put London, Oxford, Cambridge because of that. So that's my personal idea. It might work for you, it might not. But I think it makes sense now.
Yeah. But does deciding the same deanery, deciding a particular deanery mean that you'll be getting a job in that particular deanery, or is it?
No, I think I to be fair, I don't know why do they ask us Deanery preferences? So it doesn't make sense because it doesn't change anything after the interview. You can pick wherever you want to go after the interview. You just pick the area that you want to be interviewed, but it is not affecting where you're gonna go after the interview.
Yeah, agreed. It's just that I think choosing your own deanery for the interview gives you a little bit more autonomy, because you're like, okay, if I get good scores, it's because of me. If I get bad scores, well, I chose the deanery. It's not their fault. The other things that you can consider when it comes to choosing deanery, and I've talked about this in my video about the IMT interviews and everything, is how familiar you are with the accent. Because if you choose a person or a common deanery like London deanery or Oxford, I mean London deanery mainly, their accent will be more or less like yours, and they will be better suited to understand your accent because there'll be many IMGs who will be working there. But when it comes to the other sort of niche areas, there people might have a different accent, and you might have trouble understanding them, and vice versa. So yeah, think about it a little bit and put your thought into it, because you're getting a chance to choose a DNG. Make it
Make it a wise decision.
Yeah, exactly. And yeah, that brings us to our next question, which is, do you feel like during the interview or throughout the whole selection thing, did you notice any kind of discrimination that you were an IMG, so maybe you were not given a fair shot when it comes to the UK graduates?
Not at all, because my interviewers, I think they weren't also UK graduate people, so it didn't happen to me, and I don't think that it happens in the UK. It didn't happen to me at all after the interview or during my work life in the UK as well. But there is one thing now. There is one thing that people have been talking about is UK graduate prioritization. So it might happen in the next couple of months or year. There are some discussions about it. It's not. You don't know it yet, but it's not. It might happen. So just keep checking it. They might prioritize the UK graduates next year, but it's not. It's just a discussion for now.
So what Yasin is talking about is essentially the NHS 10-year plan. So in this particular plan, they want to make NHS more self-sufficient, which is they want to make it fully functional without adding more doctors or more staffing from overseas. They want to make it self-sufficient, and a way of doing this is by preferring local doctors, local staff over the overseas ones. Now, obviously, this is a big change, and we won't be seeing any of the change in the next 3 years, but maybe after that we'll start seeing something. But this is a golden opportunity for the overseas graduates to start working in UK through these training programs and these applications. So yeah,
but keep checking it, because it might be earlier than 3 years.
Yeah,
so they might suddenly put a one line saying that UK graduates or 2 years experienced doctors in the UK get 5 scores. It's an easy thing for them to change. Hopefully won't happen quickly. Hopefully won't happen in the next couple of years, because it's also there are some discussions, because it is a kind of discrimination, so it's a bit of a discriminative thing to do. So people are discussing about it to prevent it, but we'll see. Hopefully won't happen.
All right, the last question, I think, about the entire interview / IMT process is about ranking your rotations.
Oh,
Did you find it difficult? Because oh my god, it was a nightmare for me.
Oh my god, yeah. I spent 1 month to study, or 1.5 months to study for interview, but literally that ranking took my days. I spent like 8 hours, 6 hours in a day to think about, because you don't know which hospital is good, which hospital department is very supportive or not supportive, because you got lots of things to consider. City, hospital, teaching, you gotta consider about the system. Do they have an electronical system? Do they have a paper still? You gotta think all of these things and make your decision around it. It was very difficult for me, but somehow I made it. How I did it is I decided on which city I want to live, and then I decided on which rotations I want to have. I wanted to have a dermatology rotation. I put it all the dermatology, all the rotations, all the hospitals with red dermatology rotations to the first, and then the others coming from the bottom. So that's how I did
Right.
my preferences, but it all depends on what you want.
So, for those of us who have not yet applied for IMTs and are thinking about it, this is what exactly happens. So, as soon as you get shortlisted for an interview, you give the interview and then they give you a final score. Now, that can be cumulative score, as in my case, and that could be just an individual interview score. Basically, you'll just get a mail saying that, okay, you have been shortlisted for the IMT thing, and you get to put your preferences now. And in a couple of days' time, you'll get the link to sort of go through the preferences. That is a big list. You can also convert it into an Excel sheet where you can weigh all the options.
Thousands of options.
Thousands of options, yeah. 1,000, if not more.
Yeah.
So in that,
maybe 2,000.
Yeah.
Maybe
1,000.
I don't remember, but it's
It's
something
a lot.
thousand.
It's a lot. So in that, basically, like Yasin mentioned, it's basically divided into all the rotations. So every year we have 3 rotations, right? So in some of the deaneries you'll get rotations for on a 3-year basis, and in some of the deaneries you'll get to choose the rotations for 2 years. So in that you get to pick and choose, or basically put your preference according to what your first rotation should be, your second rotation should be, and then the different hospitals that give you that, provide you that rotations. Now, because of us being fairly new to the country, we did not know much about the hospitals, like Yasin said. So at that time, we took advice from our seniors who knew a couple about this and that hospital, and the famous hospitals like IMG,
Yeah.
our hospital and all of those hospitals we knew a little bit about. So we knew what rotations definitely to not take. The other way to put the whole preferencing thing is that if you're an IMG and if you want to stay in the center and you don't want to move to the corners of the country, you can always do that by choosing the zones. So the entire preference list is also divided into zones. Zone 1 being center, and then zone 2 being a little bit farther from center. And as you move from zone 1 to zone 5, you get more distant from the center. So that's how you can put your preferences. For me, and I think for Yasin as well, the preference was to be in the center, to get our preferred rotations
In a city.
in a city. And
I wanted to be in Birmingham or Manchester or Liverpool. I wanted to have some of the rotations and want to be in the city center.
I wanted the same. I wanted the city center, and I wanted to work in the same hospital because I was like, I'm familiar with the system. It's an online system. I don't want to do any more paperwork, and that's the reason why we chose this particular UHB. And I just trust me.
And so what happens after it? You got your first result, but you can upgrade it. You don't have to pick it. You can decline it. You don't need to accept it, and then you can wait for your upgrade. There are a couple of upgrades coming back to back. For example, my first acceptance was from Liverpool, then it came to West Midlands, then it's come to the city centre Birmingham, so it goes up. So it works like that.
And to those of you who are thinking about applying in various multiple training programs, you can still do that. I did the same. I applied for psychiatry and medicine training program, and I got preferences for both of those. However, when it comes to choosing or fixing one particular rotation, or suppose you're happy with this particular preference that you got, right? So at that time, if you want to fix that particular one, then you have to get rid of all the other training program options and the preferences, right? But till you have made a decision, you can still pick and choose. You can make some changes here and there, and get the best option that you think suits you best.
So I have some questions for you as well, because you got into IMT training program earlier than me, and then now you're IMT 2. So you completed the first year. Well done. Congratulations, first of all.
Thank you.
So
did I forget to congratulate you?
Thank you. You already got before.
I mean, on camera, because people were like, how beautiful.
Thank you. So I am in the beginning of the training now, and I am hearing loads of things about the portfolio, things that you have to do, teachings you have to do. So I'm just slowly getting a bit overwhelmed about it. So I need your advices on it. So first of all, can you tell us about what was your journey? Probably your followers know it, but briefly you can tell about what's your journey and how is it going?
I guess, yes, it's been kind of the same journey for both of us, right? We both were from our home countries. I was from India. I'm still an Indian. I was a doctor there. And then I decided to move to UK. I was briefly preparing for USMLE, as most of you know. And then I was like, no, let's try a lab journey. And that's what got me here. I initially joined as a non-training program. We joined in the same department, in clinical medicine. I was there for about a year, and then I got into the training program. And then, like you said, completed the first year. Now I moved to second year, and I am. Yeah. All right. Coming to the portfolio bit. So when you get to join the training program, you have to make a portfolio called as a JRCPTV portfolio, which will, if you guys have an NHS portfolio, it'll just get merged to that one. So you have to get the login ID for that, and then you have to start building your portfolio.
What are the things that you have to build up in your portfolio? Can you just tell us a bit more about it?
So roughly what I remember is, your portfolio essentially consists of your training bits, like the CBDs, the case-based discussions that you have done, the assessments that you have done, which is called an ACAT, acute care assessment tool, and your reflections about any difficult thing you saw, any difficulty in general you saw, any good thing about your journey or this or that. You can basically treat it as a journal, and then write whatever you feel you learned that day, and then you can attach it to certain SIPs. So basically, there are about a couple of questions, 6 or 7 questions, like general SIPs, and then clinical SIPs, and then there's the procedural skills. For IMT Year 1, you have to complete the procedures using Skills Lab. You have to join a Skills Lab training, which is basically you doing all these procedures performing all these procedures on a mannequin.
Okay. Not
Just
doing it. I mean, like, we shouldn't be. We can do it in our first year as well, but what is expected from us to do it on mannequins and to get trained on mannequins?
Yeah.
That's the clinical CIPs.
That's the procedural.
Sorry. No.
And then general SIPs is basically like you have performed as a clinical teacher to someone. You were taught. You're participating in these teaching programs, like every alternate Wednesdays. There are teachings organized for us. So you have completed your basic teaching hours. You have contributed enough to the ward rounds, towards assessment during an acute selected take or an unselected take, and all of these things. So there's this thing called ARCP Decision Aid. You can go through that, and that will give you an easy idea about what all things you need in your portfolio by the end of the year to proceed to the next year. And it's kind of easy. For example, you need 2 CBDs, 4 ACATs, 2 DOPs. 2 DOPs is basically
2 CBDs. Is it? Oh, really? Okay.
By consultants.
All right, fine. Great. I'll just check the numbers.
2 CBDs, 2 DOPs, 4 ACATs, couple of mini caxes, 2 mini caxes, I think, and and then obviously to make your portfolio even better, you can obviously add more by consultants, by registrars. You have to complete your clinical hours, which is I think 20 clinics per year and a total of 80 clinics by the end of IMT3. However, most of the trainees here are like so competent, they are doing most of these procedures unsupervised and
they're already doing it. I mean,
but I'm not one of those people. I'm just like doing the bare minimum. I'm like, okay, Skills Lab done.
That's enough. That is what I expected from you to finish the IMT one. No one appreciates you if you do more than what is expected from you.
True, but
just pass and fail thing, and most of the time you've passed. Regardless of how much things you have done. If you've done more than the expected, that's fine. But one of
that makes the next year easy.
Yeah,
I guess.
I think so, and you don't get exhausted.
Yeah,
which is very important.
Yeah, because once you've got competent and doing a sort of procedure, for example, a central vein, if you have done that, if you can do that unsupervised, then you don't have to get the same competencies next year. You just have to keep on doing the same thing, and you don't have to worry about people supervising you, this and that. So it's good if you get it over with, but
you can even start teaching. Yeah. So one of the things that is...
And QIPs, you have to do audits as well.
Audit, yeah, right. That's
and research publication, the same thing as IMT applications.
But research is not expected from you in your first IMT year, but quality improvement project or audit is expected for you to participate in your first year.
First year you have to participate in. For second year, I think you have to sign the whole QIP.
You got to be leader of the audit, if I'm not wrong. But first
I've talked about it in my video. So I've discussed about the QIP assessment tool. If you get it sorted in the first year, then you don't have to worry about it in your second year. So,
and the other thing that you need to complete in your portfolio is MRCP. Let's come to that point. Maybe you have already passed the MRCP part 1, but I haven't. And so tell us about the MRCP, how to study or how to get ready for it. How many months did you study for it?
Okay, so I think let's start with the basics, right? So in order to proceed from IMT1 to IMT2 is what you need at the moment. You just need to participate in MRCP. Okay? Even if you fail the exam, it's fine. Not that you should fail the exam, it's better to get it over with, but just participation is the most important thing when it comes to IMT1. Now, most of the overseas doctors who are applying for IMTs, they probably have MRCP1, MRCP2 sorted because they usually try to get done with the exams first, then worry about the portfolio. But for us, we worried about the portfolio more than the exams. And that's why we still have to do the exams. So I participated in MRCP1 last year. My exam was this year in January, but I paid for it last year. And it's a fairly easy exam. It's a lengthy one because it's, I think, 6 hours. With a bit of brief break, but when you have half of the exam left, you barely think about taking a break. But it's in general, if you practice enough past medicine questions and past test questions, I think you'll be fine.
Okay.
Yeah. Other than that, it covers the basics. It's not like really.
How long do you advise us to study for? At least like 3 months, 4 months?
It varies from person to person. So because I participated in USMLE, I had passed the steps. So this exam is kind of like steps. So I did not have to work a lot for it. But as long as you got 70% of MRC of past medicine covered, I think you're sorted.
Okay. Yeah. Fine. So that was the important part of the portfolio as well and your IMT journey. But before I go through another question, I would like to ask another question which is going to be a bit different than the IMT, but can you tell us a bit more about being a non-training and training doctor in the UK? So are there any big differences of being training or training doctor?
Okay. I guess for me, or from the hospital that we come from, we are more or less treated the same, right? I think when it comes to the training programs, you are more safe and you're more secure,
more protected.
More protected. You've got all these supervisors who are chasing after you, basically like, are you getting this done? Are you struggling? Do you need any help? This and that. So that way you're like, okay, even if I'm struggling, there are people that I can talk to.
They keep you in track.
Yeah. And because of this portfolio thingy, you have to be up to date with everything going on in your rotation. You're like, okay, let's cover this first and then worry about the rest of the stuff later. So it keeps you progressing.
Yeah.
Because you have to show that on the portfolio. And then obviously you've got clinical supervisors, education supervisors. There's this mid-interim review that they do, and then the final review and this and that to make sure that everybody is proceeding in the right manner that they're supposed to.
And so, you got your protected teaching hours, you got your protected clinical days, you got your self-development time, which is 1 day in a month, but that is really helpful sometimes because you do work on your portfolio. I think as a non-trainee as well, you can apply for these things and get these leaves, but because you're new into a country, you do not really know about these things. You're not aware as much. As a trainee, I guess you get more sort of exposure about these things. They tell you how to do that. They tell you that you have to take it, that it's your right.
You're taken a bit more seriously. You're like, okay, if you write a mail as a trainee that I want STD time for this particular thing, I want study hours for this particular thing, like, okay, well, let's give her that.
The question that I am planning to ask is actually a bit tricky question. Not a tricky question, but can you tell us, is there any salary differences in between training and non-training? So there are some differences, but is there any salary differences?
We're talking about the same grade, right?
Yeah. IMT1 GSD, IMT2 GSD, or IMT3
right. So it's not that a tricky question, but it has a disappointing answer. There's no salary difference, okay?
Yeah.
I was making the same amount as a non-trainee as I'm making as a trainee.
Yeah.
I think when I become a registrar, that's when things are gonna change a little bit.
Yeah.
But for IMT1 and IMT2, it's the same.
It's the same.
For a non-trainee and a trainee, it's the same.
Because you're doing the same job.
Yeah.
There is no differences on
We're just
your job
getting the bare minimum to survive the system and the expenses.
So the other question is, the last question I would like to ask you is, what are your recommendations for new starting IMTs?
Good
like
question.
me.
Yeah,
Tell me
you've
more
already
about you.
started. Yes.
Yeah, I already started.
Yeah. I guess for your first rotation, get started as in meet your supervisor as soon as possible.
Yes, I sent him an email, but yeah,
Yeah.
waiting for him.
So that can so
He's
that
on
varies from
holiday.
okay.
Sorry.
So that varies from rotations to rotation, right? Some clinical supervisor like they'll send you a mail right away that okay, Yasin, you're gonna join like you're gonna join this particular specialty and you have me as a supervisor, so come meet me whenever possible. That's how active my neurology consultant was. But some of the other supervisors didn't meet me for like 2 or 3 months, and then there was a mid-interim review, and then they were chased by those people, the RCP tutors, that you haven't yet met your trainee. Please get in touch with her. And so yeah, because it's your first year and you don't know much about the portfolio, discussing with them is the most important bit, right? Because they can get things sorted for you. I know I was struggling with my clinical hours because I was like, this particular rotation is not providing me as many clinic days as I need, and I just talked about it to my neurology consultant, and he got it sorted for me. He got me 6 more additional clinic days.
Oh, really?
Yeah.
Fine.
Yeah.
Okay, great. So having your meeting, initial or
Yeah.
like midterm meeting with your education supervisor, clinical supervisor,
And getting
is important.
very important, and getting a good education supervisor who knows everything about the system makes a big difference. Because I remember that I initially struggled a little bit because my education supervisor was as new as me. He
Gossips.
yeah. He, I mean, he was not really gossip. I love him, but he was initially the supervisor for the registrars, so he did not know about us. So we were sort of figuring it out together. We were both writing mails to the same people asking that, okay, do you think this needs to be done? And my supervisor is also asking the same question. So yeah, it was
try to be helpful.
Yeah.
Okay.
Yeah, he was really helpful.
What else do you recommend us?
I think, when it comes to portfolio, oh my god, I forgot talking about the tabs. There's this thing called, so this is a team-based assessment. Team assessment behavior, I think that's what it's called. And you need the forms or the tickets to be filled out by the consultants, your colleagues, your non-medical staff, and all of these people during the same rotation. You need to send it out to 15 people, and 12 of them should at least respond. So you need to get 12 responses minimum to get the whole tab assessment done for you. And my god, I struggled with it. That was the most difficult thing for me throughout the year. And I'm still thinking about the whole thing, like that I'll have to repeat the same thing this year, and I'm scared about it. Because initially I didn't care. I was like, yeah, I'll get 15 people, easy peasy, but not all of them respond. Especially,
it's difficult to get the response. You just gotta make pressure on them, because I did it in non-training as well. But yeah, you're right.
I mean, for the non-training, I had the same thing. It was the what was that thing? Appraisal form.
Yeah, for the
but
appraisal.
For that, you just need the forms to be signed by your colleagues, and they want the same thing from you, right?
That's true.
They're good at responding.
You did it.
Yeah, so they're still good at responding. Colleagues are still good at responding. Consultants are good at responding.
How many non-medical people do we need for it?
I got it from half of them were non-medical.
Oh god, half of them.
At least.
What is
by non-medical, I mean the non-doctors, as in the nurses.
Could be nurses. Could be like.
2 of them should be the head of nurses. So band 6, I think they should be like that. So they were also quite good at responding. It's the HCAs and the new nurses who aren't so much aware of the system or our system, were like a bit like, yeah, I'll do that. I didn't check my mail, so yeah.
Okay.
You have to nudge them a little bit.
It's just people needs to be chased. Sometimes we also needs to be chased.
Consultants who are the quickest to respond to tabs or any ticket.
They're the busiest one, but probably they're
the thing with consultants is that either they respond and respond very quickly, or they don't, and then they won't ever, no matter how many times you send them the very same email, they won't respond. So yeah, okay, at least you know where you are headed with them. With other people, you just have to nudge a lot.
Okay, so the tabs needs to be
as soon as possible.
Done
get your ACATs sorted so that you don't have to worry about it, because it's like an amalgamation of 5 cases that you have to present to one particular consultant, and it's really difficult to get
one consultant
to see all these 5 cases, because as you know, in our case, the ED and acute takes, the consultant keeps on changing, right? So it's very difficult to
get it done. But you can get it done in wards.
It's not very difficult. It's doable, obviously. That's how everybody does it.
You find out your own particular way to get everything done.
But just do it as soon as possible so that you don't have to worry about it for the rest of the day.
You can spend your time to study for your exams or
enjoy your life.
Yeah. I mean,
the other thing that I forgot.
That's important. because IMT is a bit what I see from my first couple of weeks. It looks like you got lots of things to do, so you have to balance your life and you have to balance your work life and your social life at the same time. So it might
It's a good thing that I don't have a social life.
You gotta have, because otherwise, yeah, it might get overwhelmed easily, and it's also important. It might happen.
Yeah.
We'll see. But yeah, that's it.
It can be overwhelming at first, but
yeah,
like my
especially if you're new to the country, that might get a bit more tricky, because I see some of the IMT trainees are directly coming from the overseas to the UK as an IMT trainee or as a GP trainee or psych trainee. I think
that's exceptionally. That's definitely difficult for them because
it might be it might be very difficult.
Yeah, try to get into a non-training program first before applying for training programs, because then you're like everybody's looking at you, everyone's eyes.
They're expecting you to do the jobs and everything, but you are there and trying to understand what is portfolio. What is that? But
if you haven't applied for non-training program and you still got the training program, take it. I mean, it will obviously come with some difficulties, but it's gonna be fine.
People will support you. We will support you.
Yeah, like my
we will make videos.
Yeah, we will make videos. Even if even if we release the videos once in 6 months time, but we will do our bit. And as my consultant said, he's my non-training supervisor, Dr. Reddy. You know about it. So he was like, stop worrying about all these things, because whenever you're at the top of the pile, that also puts you at the bottom of another pile. So I guess that's what has happened with us.
That's life for the UK.
Yeah. That's life everywhere, I guess. When you get to a new position, you're like, oh, finally I'm here. And then you're like, oh no, there's so much stuff to do. But that's life. So I guess. Yeah. And we're all gonna die one day, so how does it matter?
Very true.
That's not a very good way to end our video.
Yeah, it's not a
It will get sorted.
Yes, don't think about it. It will be okay.
Yeah, just do what's needed from your side. And that's it for today, I guess.
Thank you for inviting me and having you as your guest with your followers.
That should have been my line. Thank you so much, Yasir, for taking the time.
Of course.
To join us, and from a very busy schedule, because he's in ITU at the moment, and oh my god, it's
as you see, I just came from work and then joined her while she was chilling.
While I am on the same rotation, by the way, I did my long days, my fair share of long days. My last long day was yesterday, and I was very exhausted. I was contemplating.
Yeah, after it. Yeah. She was recovering from it.
I'm gonna go back to sleep now. All right then. Thanks so much, guys. And we'll see you guys in the next video.
See you. Bye-bye.
Bye-bye. Hi guys, welcome back to the channel. I'm Kekisha Mamtaz. You're making a lot of noise, you know that, right?
This has bloopers.
Okay. If you have any doubts,
if you have any questions or any doubts, you can leave a comment under the YouTube video, or you can text me on WhatsApp. No.
I was like, what?
You can text me on Instagram, and then we can talk about it. Of course.
Or else if you just want to text,
I can give you my number.
Yeah, I mean I have the number, so I'll do it. It's fine. I'll put it in the description somewhere. But yeah, if you have any doubts, just drop down a comment and we'll try to get back to you as soon as possible.